Hello and welcome to Shine Chats. My name is Scott Jackson. I'm the Vice President of Surgical Solutions here at Henry Schein. And joining me today is Mandy Hawkins. Mandy is the Director of the Surgery Center of Charleston in Charleston, South Carolina. Mandy is also the President of the Board of Directors at ASCA. For those of you that are not familiar with ASCA, ASCA is the trade association that represents and supports ASCs across the country. Having said that, Mandy, it is a pleasure to have you here. Great to see you again.
You too, and thank you for having me. I'm grateful for the opportunity to talk with you today.
Well, good deal. Well, good deal. So obviously, we're here to talk about ASCs. That's the topic of this discussion. Mandy, you're close to ASCs. You run one there in Charleston. You're on the board at ASCA. So you've seen a lot of different you've seen a lot of different things related to the industry. What's interesting is this industry has grown significantly since the early 70s, which I think is when the first ASC was built. And since then to today, there must at least be 7,000 ASCs across the country. So obviously, there's been different factors that have led to that growth. What do you think are some of the key elements that have driven the growth of ASCs?
Yeah. ASCs bring such a huge value to our customers and patients, Medicare beneficiaries. I think there are probably 4 top things that surgery centers can bring. Number 1 is convenience. It is so easy to schedule a surgery. You're much less likely to be delayed or have to reschedule. Surgery centers are really good at picking out the right patients that can be done at our center. You have shorter wait times, shorter recovery times, and the location's usually really easily accessible for patients to find. The second thing I think that's really important that we have done is we're a safer site of service. ASCs have a lower risk of infection, lower risk of surgical site issues. We have positive clinical outcomes like lower readmissions after surgery and lower post-op complications. And these would be mainly compared to a hospital setting. So I think by those things happening, it's really pushed a lot of those procedures out to us. The third thing, which is probably the most important thing to the consumer, is the lower cost. Medicare beneficiaries generally pay twice as much for a procedure in a hospital outpatient as they do at an ASC. So I think slowly over the years, let alone Medicare beneficiaries, consumers, payers, and stakeholders are starting to see that we are the lower cost alternative. Let's start to push patients to go to an ASC. So we're kind of the answer when it comes to the lower cost. Not only that, ASCs, I think the last numbers I looked reduced a healthcare cost $38 billion a year. And I think they're predicting through 2028 for Medicare beneficiaries, it's like $73 billion, which is a lot of money to save healthcare because it's one of the higher areas that spends money in our economy. And the fourth and most important thing that ASCs provide is quality. Quality goes a lot of different ways. Quality in our patient care, like we all have increased patient personalization, one-on-one care. I think that's really important. Patients feel like they have direct contact with the physicians. They can talk to them at the center before their surgery, after their surgery. A lot of surgeons at ASCs, I think, call their patients the night of surgery, which is kind of a personal touch. But more important to quality, surgery centers are the most highly regulated healthcare industry. From my experience, I was in the hospital industry for about 11 before I came out into the ASC, and I've been here for about 13. I think that we are held to a higher standard than hospitals. There are more than 6,000 Medicare certified ASCs that we follow a wide range of laws, rules, and regulations from accrediting bodies, from CMS, and from states. So they come in and do frequent and regular surveys and inspections. They maintain a full control over our infection control, our environment of care, safety. And I truly think that they're harder on us than anywhere else. And there are a couple accrediting bodies. JACO, I think, is really common in the hospital industry and at some surgery centers. AAHC, and another one is Quad ASF. And I've worked with JACO and AAHC, and I think they're really hard on us, a little bit easier on the hospital. So if you get that accreditation, you have that gold standard. And as a patient, as a consumer, as a Medicare beneficiary, even for my parents, I want them to go to a center that has that accreditation.
No, that's a great point. And, I think when you look back at what you just mentioned, it's cost, it's convenience, it's safety, saving the healthcare system billions of dollars every year. That's great. And I'm sure with the growth, there's been challenges. Obviously, today we know that the labor shortage is a challenge everywhere, whether you're running an ASC or a restaurant, right? So how are you dealing with that from a labor standpoint?
I think it is everywhere. It's not just me. But I know having experienced, trained staff really makes centers run smoothly. We perform so many different surgical specialties across all ASCs. You're seeing total joints, ENT, cardiac procedures, pain and plastics, eye surgeries, general surgeries. And it's not only on adults, there's pediatrics that are being done in outpatient centers. So staffing is really, really important. I think here at my center, we try to offer quality of life. It's a big deal not to, have to work those late shifts and you get to be home and have dinner with your family. Some centers do work on Saturdays, but you still get a good bit of your weekend and you don't have to work that Friday, Saturday, Sunday like you did at a hospital. We offer flexible scheduling and a little bit more accommodating. We realize childcare costs have gone up. So I have some staff that share shifts, or some can come in later so they can get their kid to a childcare. And we can do that because we have a little bit smaller of a center and can work with each other. There's a little bit of opportunity for growth that we try to offer. A lot of nurses come in here and they may have only worked in a recovery room. So what a great way to keep employees. I can teach you several other different areas of the center. You can learn how to work in the operating room. You can learn how to work in the pre-admissions area. You can get into leadership and learn how to do different type of quality improvement projects and actually build your way up into management. I think that's great job security, job retention, and builds a good level of teamwork too. I do think we also have better communication. I feel like people don't have as much anxiety and uncomfort at work when they know what's going on. A lot of times when I worked in the hospital, I almost felt like I don't want to say a number. I think that's the cliche that people say. But I know everything that's going on here. All my employees know what's going on, what's coming, so they can plan for their life outside of work too. So when they come here, they work hard, but when they go home, they get to go home and be with their family. I do think ASCs have a huge opportunity when it comes to staffing. We need to educate. We need to reach out to local universities and get medical students in here, and we need to get nurses in here. Physicians need to know that having a surgery center, being part of one, is easy scheduling for their patients. They have more control of their schedule, their environment. They're working with the same team every day and the same equipment. It's such a great opportunity for them to be a part of an ASC. 70% of physicians are owned by a hospital. That's so high. These physicians should be able to have their own practices and their own ASCs and be able to succeed at that. So I think we really need to cultivate a new culture for ASCs and start getting out there and teaching people what's here.
Well, it's all very exciting, Mandy. I think you and I could talk all day about ASCs.
We could.
But it's great to hear what you're saying. ASCs are saving the healthcare system billions of dollars, providing great care, and also providing a good place to work with a good quality of life.
Yeah.
This discussion has been very timely as well, because this is the National ASC Month. August is actually National ASC Month, so we're right in the middle of it. This has been a great opportunity to elevate the value that ASCs play in our healthcare system and for us as consumers. Mandy, we appreciate you being here. We appreciate what you do there at your center, what you do at ASCA there on the board. And we thank you for your time. Very generous of you. And we also thank all of you for watching Shine Chats. We hope to see you on a future one. Thank you.
Thank you, Scott.